Hi everybody, I'm Susan Collini and welcome to our monthly roundtable from the Renaissance Center for Plastic Surgery, the Collini Laser Clinic, and Age of Innocence. I'm hoping that we're doing a visual here with the pink because as we all know, it is Breast Cancer Awareness Month. So we always like to do a shout out each year when we're discussing things online with patients or when we're giving out some messaging. And we want to make sure that our patients know that this is a part of our culture here. It's something that we do take care of patients with breast cancer and let you know what we do. We're not here to give you your diagnostic information. I mean, that has to be with your primary physician and your initial breast surgeon. But if you know that we do plastic surgery here, we are a reconstructive center. And we chose this venue. Now we're actually in our recovery room right now. And instead of sometimes you see us in the waiting room or you see us in the laser clinic. So it's a little bit of a departure for us because I think this is a little bit more of a clinical topic than our normal cosmetic, discussions that we have. But I really do think that that when we do breast cancer patients, we're already getting them once they're post mastectomy. Typically. So we can do coordinating efforts with the surgeon where we do immediate reconstruction. That just takes a lot of coordination, but a lot of times we do get patients that are already post mastectomy, and that's when we do the reconstruction. There are a lot of different reasons why you may or may not choose those avenues. Those conversations really need to go with, they need to come about with your primary care physician or whoever the physician is that's managing your breast cancer. So there's some moving parts. But we get the part where we try to make everybody look better after the fact. So, I know it's an emotional struggle, it's an emotional everything, and I know that there's so many things that we see our patients go through and that are really important, but I think that I think we do a great job here with what we do. So I think I'm going to turn this over to Ronnie in a second. I just want to go over that there are basically 3 types of reconstruction that we do here in our center. We can do breast implants. We can do what's called a latissimus dorsi flap, which is, and I'll let Ronnie talk about it, what he sees in it, but we actually take a muscle from around the back and create a breast. And there's also a tram flap, which is taking a muscle and tissue from the belly and creating a breast. So those have other ramifications beside that, but I'm going to let Ronnie say a few things. And I didn't introduce everybody, so I'm sorry. Ronnie is our medical assistant in our office. He's here to your left, and to my right are the girls. And this is Suzanne, and this is Ashley. Hi. And they both we're all working members of the team. So
Derek might pop in
and
too.
Derek might pop up where the flowers are. So we left a little pink there. So go ahead, Ronnie. Anything that you want to add?
So for post-op mastectomy patients and such, sometimes there's a lack of tissue in the area, and the one thing we definitely help patients with is getting them back to an aesthetic that they want to be at. And with the different types of flapping procedures that doctor does, we can make the area bigger so we can accommodate the implant that you want. So
tissue expanders?
Tissue expanders are an option sometimes. The latissimus dorsi flap, where doctor is taking muscle from the back, pulling it around the front, making room for the implant to sit properly and function as well as possible. So there's many different options, but we're definitely always here to help patients and get them back to where they want to be.
Right. One of the things that I think, here's Derek. Come on in, pop in, Derek. You're going to hold the flowers.
Sorry, guys.
You're going to hold the pink flowers. There you go. Derek is our director of laser clinic, so we just got started here. Sure. But one of the things that I really would like patients to be aware of, because sometimes I think that patients have in their mind when they get reconstructed, they're used to looking at breast augmentation patients and they think that their breasts are going to look just like they would if they just went and had implants. And that's not the case. I really think that if you decide to choose this course of reconstruction, that you really go online and start looking at true, realistic patients from medical review things. Don't look at people that think they're botched, because there are people that think that way. You've got to remember, you've got some scars, you've got a lot of tissue, you've had irradiated irradiated tissue that compromises healing.
Yeah.
There are a lot of things that go into the reconstructive aspect, and make sure that you are aware what the prospect of what you're going to come out to look like, so you have a realistic expectation. And I think that that's probably one of the biggest problems that I have seen over my entire career. And I have seen some great reconstruction here, and even then, I think sometimes patients think that it's going to be like a perfect breast implant augmentation procedure, and it isn't. You have to be aware of that. The other thing that we do is that usually when patients do get reconstructions, there are always multiple procedures. It's not kind of like a said one and done. And patients do come back over the years because maybe they have problems with an implant, maybe they have gained weight, lost weight, had some issues with the breast. So we do see patients, multiple times over the course of their lifetime. It'd be nice to say one and done, but it doesn't always work that way. We like it to do that, but and one of the other things is that usually when patients get mastectomies, they get the nipples and areolas removed. So one of the things, we can reconstruct the nipple areolas surgically, but one of the most popular trends now is actually tattooing.
Yeah.
And so we actually have a great cosmetic medical tattoo artist that does 3-dimensional areola tattooing. You can see her work too, and it really is wonderful. I think it's actually better than going through doing some of the tissue. They look
very
amazing.
Realistic.
Really
she matches
amazing.
them to your size and color or whatever you want.
Now the only problem is when you're going to a tattoo artist, that part's not going to go through your insurance, so that's going to be a cosmetic thing. But I have to say that we help give some money towards that situation, so we try to reduce the cost if necessary for those patients. But so that's kind of the medical overview. Did anybody have anything else to add on those particular procedures?
Really just that once people have reconstruction and they are a little self-conscious about maybe the scarring, and even though it's a plastic surgeon, that is funny that people still will think that there's no, if you cut the skin, there's going to be a scar. He just does it in a way that it's going to be a much better scar than you would have otherwise. But for that, Susan and Doctor are nice enough to discount patients that are going through that for scar revision if they got the surgery here. So what we do is, depending on what modality we have to use, we can reduce the coloration of the scar, the actual scar itself. It just depends on your situation, but we have great results with scar revision with lasers.
Right. I think that the options that we have are really wonderful. So, we talked about that there's secondary reconstructions already. We just talked about the fact that you're not one and done.
No.
So sometimes you do need multiple procedures, or even down the road, if problems do arise, because implants, that's the nature of the beast sometimes, that there can be problems with implants.
And with tissue expanders, that's even sometimes a couple more procedures, in the office, actually filling the implant with saline and getting your tissue to the right size to fit that implant that you want. So
there's a lot more to it.
It's just a couple steps, but we get you there.
Right.
But you're in good hands.
That's for sure.
Thank you. Now, one of the things in getting to us is the referral system. Patients wouldn't just really automatically come and walk off the street to come to us. It really needs to be a dialogue between your surgeon and a relationship with Dr. Collini. So not that you couldn't do that, we could help facilitate, because our patients that we've done for years and years just come to us now, but that initial response needs to be with a referral. You have to go through that process. If you don't know how to do that, you could always call our offices up and we could help facilitate that. So that's an important housekeeping thing if that's your issue. And the generalized issue here also is that we have that people are mindful, women are mindful of doing your self-breast exams every month, that you do get your mammogram or your MRIs or the other imaging modality things that you need in order to make sure that you're taking care of that. So those are things that we have to put on the patient. You have to be the one to step foot in the door.
And if you are an implant patient, you still have to get that mammogram. I know that some implant patients think that they're like, oh well, I wouldn't be able to do it. They still do mammograms with implants.
They're not too
They're
pleasant.
not
I
nice.
have to say they are
I
not
have
too
a
pleasant.
family member who's had it done. She said it is not nice, but it's still just as important to check.
Right. So that's an important thing. I mean, this topic is so vast, and I don't want to be like the medical expert here. So I'm going to be touching bases on different things that people can look out for their own. So one of the other things that if you're checking things in your wheelhouse about your, you know, the possibility that you have a higher risk than other people, that comes from familial, from family members. So if you have a direct female mother, aunt, sister, somebody like in that close range, you're at a high risk. You might want to consider having a test called the test for the BRCA gene, which is BRCA. That's the gene that Angelina Jolie had that prompted her to do her prophylactic mastectomy. So that is something that we do ourselves, that a patient could come in and self-refer for that, because we could actually do the mastectomy. Dr. Collini is a board certified general surgeon as well. We just don't normally do that in our practice, but as far as doing the overview of a mastectomy, that we just usually do the reconstruction. But if you're looking to do a prophylactic mastectomy, the really nice thing about doing that is that there's actually more control when somebody, wait a minute, maybe I should back up. People may not know what a prophylactic mastectomy is. So prophylactic mastectomy means that you know that you are a really high risk and you do not have cancer at this point, but you electively decide that you are going to have a mastectomy and reconstruction. So that's what a prophylactic mastectomy is. And so what the advantage of doing that, and I'm not promoting this is really something that you have to decide in your own wheelhouse. This is not a promotion. I'm just trying to give you why some people would do this and why the Angelinas did this, or other famous people that you might have heard. I mean, it's a peace of mind for some people that are so frightened about getting breast cancer, and if they take everything in their own hands, then they have control of the situation. So a prophylactic mastectomy for us, when we look at it, it's actually where we have the most control over the tissue, because once the woman has not had breast cancer, that tissue's not irradiated, she's not had chemotherapy, she's not compromised. We get much better healing and much better results from a cosmetic standpoint of view with a prophylactic mastectomy. So those are things, again, that somebody could talk to us about if they want. Insurances don't always cover that. So we've had a few patients that we're lucky enough to have insurance coverage, and then most of the patients pay out of pocket for that. So it's, that's something I wish we could change, but that's really out of my wheelhouse.
Yeah.
Does anybody have anything that they want to add to the medical aspect of what they've seen?
Well, I was gonna say too, like, at home you can also do self-examinations. If you're in the shower or you're putting lotion on and you feel anything suspicious, any lump, it's better to get it checked out, even if it is nothing, because that could potentially save your life.
Right. I mean, just be aware of your own body, and don't. And sometimes I have to say, because we're going to talk about little personal anecdotal things in a minute, but I know my sister. I have family members that have had cancer, and it wasn't felt. So you have to be aware of that your testing, your imaging is really, really, really important. So
and know your history.
Right. Know your history, know where you're coming from, and it can happen at any time. So I mean, I have an aunt of mine that got breast cancer in her 80s. The good thing is, if you get it at that late stage, it's usually always curable. So you don't have the same devastation.
It's a very rare instance, but men
can get it. Good bring up.
Well.
Thank you, Derek. Yes, men can get it. We have tested and we have done a few mastectomies on men over the years, and now there's not reconstruction with that one, but
it's possible.
But it is possible. So men do need to be aware of that situation. So we don't want to just say this is for women. Men can wear pink.
Yes,
They can.
I like your pink, Ash.
I know. She's so right.
My new pigs. They're always coming out with new colors. colors.
Yeah, I said, remember, it's breast cancer awareness. Put on a little pink.
I went home and I got my brightest pink scrubs I could find.
We got the flowers.
That's right. So again, we're talking about just being mindful. Think about all aspects of cancer, mole removals, lumps and bumps that you know don't belong in your body. Get them
Always
checked
check
out
them.
from your physician,
sure.
your primary physician. And I think at this point we've probably hit as much medical information as I want to get into, because that's not really what we're here for. We just want to be mindful of it and tell you what we do. But I know that I wanted to turn this over to Suzanne. Suzanne had some anecdotal story that she would like to tell, so.
Sure, I think it goes along with prevention. So a couple of months ago, I was just at like my normal general practitioner just checkup, and she actually recommended, because I have a little bit of familial history with various kinds of cancer, like nothing crazy, but some. She's like, oh, I think you should, get genetic testing just to make sure. So I did, and it came back that I luckily do not have the BRCA gene, but I have a thing that's called a CHEK2 variant, and with that, you're about a 30% or so greater risk than the general population to get breast cancer. And as scary as that is, it's also extremely empowering, because once that happens, for me and for people who have the CHEK2, you go on a 6-month schedule of various different kinds of screenings. So I'm younger than 40, so I actually started my mammograms years before I would have normally, and I would do mammogram, then 6 months later an MRI, and that's the cadence that it goes. So if God forbid anything does ever show up, you're catching it so early that you can do more about it.
Lumpectomies, we didn't talk about a lumpectomy instead of a mastectomy, so that's really the trend, and that's what you would be probably a candidate for, catching so quickly.
And I think it's just empowering, because that you have a little bit more control over something that may or may not ever happen, but at least you get to kind of take the control back of, at least I'm getting tested every 6 months. So it takes something that's kind of scary and actually turns it into something empowering, because you have more control over your own health. And that all kind of came out of just a mouth swab.
Mouth
test.
swab. I was going to ask, was it like a blood test, just a mouth
Nope, they
swab?
actually sent it to me. It was through Geisinger, and they sent me a little test.
That's
and
interesting.
that's it. And then interestingly enough, because I have that particular variant, everyone in my immediate family was able to get tested for free, even though I have brothers.
Okay.
There's certain things that, because of the CHEK2, you're also more likely to have colon cancer, and there's a couple different things that they'll check for that they actually test your immediate family for the same thing.
Wow.
I'm sure that varies based on insurance.
That's something
but
I even knew, because I'm not in the hospital setting anymore, so I don't see all the nuances that they're doing for testing. So that's
so it was something that
It's
I
all
would
in
have
the
never thought
genetics.
to get done, unless my GP was like, "Oh, hey, I think you should maybe just check this out." And
I mean,
for me,
why
it was so
not?
great.
Yeah.
that's perfect.
Better
That's
to
really
be
The
safe than
testing
sorry.
Absolutely.
It's amazing.
Absolutely,
It
do
is.
things from your home anymore.
it is.
It's crazy.
It's too weird.
Swab your
It's too
cheeks
weird.
and you know what's going to happen.
There you go. Anybody else have something to add?
No, you were going to talk about a lumpectomy, so what is that? That's a more simple
Right, so that would
procedure,
be,
but-
that's really, most doctors don't go right into mastectomy mode.
Which is total breast
Total
removal.
breast removal. And you could have nipple areola removal. So there are little different levels of mastectomy.
Okay.
So it's not just as simple as a mastectomy. There are different ones where they take the lymph nodes out. We go to the lymph nodes because they test the lymph nodes to make sure that it's not gone somewhere else. The cancer hasn't migrated someplace else in the body. So that's one thing that we forgot. Sometimes, because I'm not doing that clinical stuff anymore, I forget a part here or there, and then I'll throw it back in. But the lumpectomy is just literally because if you caught it within 6 months and it's so small, they would just cut out a little small piece of the breast and you wouldn't even need any reconstruction at all. So that's the other advantage of making sure that you're on top of everything that you're doing as far as testing and being mindful. So anyway, anything else?
I don't think so.
think that this was an interesting
Absolutely.
topic. It's not always our most fun topic,
No.
but it's fun that we can all come together as women and as people and celebrate. You know, they had the race in Pittston with
Yeah,
the,
Pink
what was that
Pittston
called?
Pink. Anthony did his
Yeah, we
his
had one of our
fundraising.
nurses do
Yep.
fundraising, and he ran in his high heel
Yeah.
boots, which we love. So, you know, we're always trying to participate and to be community minded with Breast Cancer Awareness Month. So it's important, and we celebrate you, and we hope you have a great month, and we will see everybody next month. And stay tuned, because we have some interesting things going in. We have our open house next month, and winter
November
is
16th.
coming. Preview, so it will be very interesting next month. So stay tuned with us, and we'll get back to our silly selves.
Yes.
Yes.
All right,
Thank you.
everybody. Bye now.
Bye.